Okay, and I mean, I was looking at the article, and it also suggests some mechanisms of how this would work. Do you want to tell us a little bit about the potential mechanisms? So,
yeah, I mean, we're into the realms of speculation really when we're talking about mechanisms, because we, as you said before, all we've shown is an association, and so anything, any discussion about mechanisms is speculative. We didn't, for example, do brain scans on these people or look at any genetic markers. But one possibility is that that this is to do with creativity, because there's been, as I said earlier, a lot of anecdotal evidence that that creativity and bipolar disorder may be sort of linked in some way.
you talk about hypomania, how hypomania, which is a milder form of a manic episode, I mean, can actually make people more creative. I mean,
yes, I mean, I think that's possibly slightly different from the sort of creativity mechanism, if you want to call it that, because I think there may be a separate there's a separate possible mechanism. One of them is creativity, but there's not all that much to say that being creative would necessarily make your school grades better. But another possibility is that it's just simply to do with hard work, basically, for want of a better word. That people who perhaps have a predisposition to bipolar disorder, and to also would also be predisposed to mild hypomania, and most people, even people with bipolar disorder, will tell you that when they're in mild hypomanic states, that's actually quite a good thing. It's not only a feeling that they enjoy, but also they often feel that they are quite productive at those times, not just creatively, but in terms of being able to focus and concentrate hard, to be able to work for long hours, to be able to have a large output in terms of the amount that they're writing or whatever. So I think that might be another mechanism. I don't think that necessarily is the same thing as the creativity point. It may be that they're two subtly different mechanisms operating.
And you acknowledge that this may be a limitation of your study as well, because some of these students could have been hypomanic at the time, right? I mean, there's no measure of that, so they may have started becoming bipolar or being hypomanic at that age. And we know, I think, mania starts earlier in life than depression, isn't it? So I think there are studies on that.
Well, as I was saying earlier, we did try to mitigate against that as best as we could with the data we had available. So we excluded the first year after the exam. So anyone who was admitted to hospital with any psychotic disorder or bipolar disorder in the year after they took their exam, we excluded them from the study on the basis that they may have actually been manic at the time of the exam, and we wanted to exclude that possibility. But as you say, there may have been people who were perhaps starting their first episode of mania and it hadn't yet been diagnosed, or perhaps even it had been diagnosed but they hadn't been hospitalized yet.
I see. Can we just conclude this first part of our interview by thinking about what, let's say, the service implications of your findings might be? I mean, people would like to know maybe perhaps how such important findings and data could be used for improving our clinical practice. I mean,
I think it's important to bear in mind the limitations of this study and not to jump to too many conclusions on the basis of what is it's a large and, to my mind, fairly persuasive study in terms of the numbers of people involved and the methodology, but it doesn't really get at the mechanism as we've talked about. It just shows fairly strong evidence that there is an association, but what we actually do with that information is not yet particularly clear, I don't think, from the study.
I mean, do we start screening for potential bipolar cases in people who are doing extremely well?
No, I don't think it does imply that. And I think that, as I said earlier, the vast majority of people who do very well don't get bipolar disorder. Exactly. 98-99% of them don't get bipolar disorder. So it would be a pretty useless screening tool if it only identified such a small proportion. The other thing is that of all the people with bipolar disorder, only quite a small proportion actually do very well at school. So it would be a test with a low sensitivity and specificity, and it wouldn't be very much use in clinical practice as a prediction tool. Perhaps the only way I can see it being used is that when perhaps one was assessing a patient who was presenting with very early features of bipolar disorder or equivocal features where it wasn't very clear whether this was an episode of bipolar disorder or not. If the person had done extremely well at school, you might sort of enter that into the equation just as a small element in the overall gestalt that you were weighing up, and it might tip you slightly in favour of following that patient a little bit more carefully than you might otherwise have done.
I think clinically we do such things, but at least now there is some data to back up decisions like that. So. Okay. Do you want to have a break, or shall we just move to the second part?
No, I'm happy to move on.
Okay. Just the second part, I think I'll skip the Greek press, because I think they more or less reported what the IOP press release was talking about. So at least from one or two newspapers, I read things were reported properly. It's difficult, I think, for journalists and for lay people to understand all these associations we were talking about. And I think as an organization, we ought to make this more clear to people so they don't misinterpret or go over results and findings like that. And I think you helped us to understand some of these finer points so far. So most people who do well don't develop bipolar illness, and
yes, I think that is an important point to make.
Yeah.